Person-to-person spread of new coronavirus in the United States confirmed. The 2019 novel coronavirus, 2019 nCoV, has spread between 2 people in the United States, representing the first instance of person-to-person transmission with the new virus in this country, according to the CDC. Previously, all confirmed U.S. cases had been associated with travel to Wuhan, China, where an outbreak of the respiratory illness has been ongoing since December 2019. This latest 2019 nCoV patient, a Chicago resident, has no history of travel to Wuhan but is the husband of the Illinois woman who was diagnosed with 2019 nCoV infection on January 21, 2020, who traveled to China. Given what we've seen in China and other countries with this novel coronavirus, CDC experts have expected to identify some person-to-person spread in the United States, said CDC Director Robert R. Redfield, MD. We understand that this may be concerning, but based on what we know now, our assessment remains that the immediate risk to the American public is low. Both patients are in stable condition and being isolated in a Chicago hospital, according to Illinois officials. Image result for states confirmed with nCoV. This second patient did not travel to China, indicating the first person-to-person transmission of a novel coronavirus in the United States, said Ngozi Ezike, MD, the director of the Illinois Department of Public Health, who reiterated Dr. Redfield's comment that the risk in Illinois remains low. This person-to-person spread was between 2 very close contacts, a wife and husband, Dr. Ezike said. The virus is not spreading widely across the community at this time. We are not recommending people in the general public take additional precautions, such as canceling activities or avoiding going out. She said monitoring will continue of close contacts and healthcare personnel caring for the 2 cases. This case is not a surprise. I'd like to take a few moments to put this news into perspective, Dr. Redfield said. Limited person-to-person spread of this new virus outside of China has already been seen in 9 close contacts where travelers were infected. According to the World Health Organization, 182 total cases have been reported outside of China. The full picture of how easily and sustainably the 2019 nCoV spreads is still unclear, he added. It's important to note that this spread was among 2 people who were in close contact for an extended period of time. We've seen this in other countries with this new coronavirus, Nancy Messere, MD, the director of the CDC's National Center for Immunization and Respiratory Diseases. I understand how this may cause people to be worried about the virus and how it could affect them. More cases are expected both among travelers to China and their close contacts, she said. Moving forward we can expect to see more cases, and more cases mean the potential for more person-to-person spread. We're trying to strike a balance in our response. Right now we want to lean forward and be aggressive, but we want our actions to be evidence-based and appropriate to the current circumstance, she said, adding that the CDC does not currently recommend the use of face masks for the general public. The virus is not spreading in the general community. While it is cold and flu season, we don't routinely recommend the use of face masks by the public to prevent respiratory illness, and we certainly are not recommending that at this time for this new virus. For the general public, no additional precautions are recommended at this time beyond the simple daily precautions that everyone should take to avoid a respiratory infection, get vaccinated against influenza, and take precautions to stop the spread of germs, and take influenza antivirals if prescribed. In addition, the CDC recommends travelers avoid all non-essential travel to China. The CHC has more information about the current outbreak in China, as well as travel health information.